forward. There we go. Okay. Again, thank you all for coming tonight. The reason that I was really wanting to do a extended workshop on well, come on, sorry, I'm talking to myself, on well child visits, is because on one of the medical home meetings that Kim and I were recently on, we were talking about well child visits and families that have kids with a chronic illness or a disability. And one of the things I think that is really important that doesn't always happen is that population in general doesn't always, they're frequent flyers to the clinics anyway, so they don't always think about the need to do well child visits. And following that that meeting that we had with Kim Ruby, I think it was a medical home meeting, Kim, Pat Spear had sent a presentation that they had done for a collaborative work group that they had done in 2019, I think. And that being said, I asked her, I said, this is perfect. Can I utilize this, but adapt it a little bit? And she said, yes. So that here we are. Hi, Joan, welcome. So that's how we came to be on well child visits. So we're going to talk about well child visits, what they are. There were actually more providers that decided to join us tonight than parents. So I'm hoping that when we post this up on the website, that more families will be able to see it and identify why it's really important for our kids that are medically involved, why the need is there to do those well child visits. And you guys can chime in at any time to add any piece, and that's really welcomed. So a well child visit is really designed to prevent the health problems. It's different than any visit that when your child sees a healthcare provider because they are sick. And so we're going to talk a little bit about that. Well child visits really are best practice, and what's used most often is usually the Bright Futures guidelines. And Bright Futures is their principles and strategies to support practices to achieve excellent quality of care for children and families. It's a set of evidence-based guidelines that is used across the country. There's support for team approach and the medical neighborhood, and evidence supporting community influences, especially social determinants of health. And it's really vitally important for caring for children and families. So a little bit about Bright Futures. I don't know if many of you know this, and it's going to age me quite a bit, but the primary goal of Bright Futures is implementation to support primary care practices in medical homes in well child and adolescent care. There is a Bright Futures guidelines for health supervision of infant children and adolescents. I think it's pretty well broadly utilized by many practices. And it really started 25 years ago when a multidisciplinary group of pediatric healthcare experts and family representatives had this picture of what the country's health should look like in America. And actually, Family Voices was a big part of that. And there were several work groups that I was a part of for those beginning phases of Bright Futures. So that does age me kind of a lot. So anyway, I know that there was one group in particular that convened in Washington, D.C., and that was initiated by the Maternal and Child Health Bureau. And then the Academy of Pediatrics were there, and many of us as Family Voices representatives were there too. So the first edition of Bright Futures came out in 1994, and Family Voices has always been an integral part of that process. On the bottom there is a link to YouTube, and it discusses the Bright Futures guidelines for well child visits. I don't think I'm going to show that because then I'm going to lose all of you, and then I don't know where I'm at because this is all it's hard to do the presentation and watch everything else at the same time. There are some that probably don't know much about social determinants of health. So I put in a couple slides in here about what that really means. There's 5 domains to social determinants of health, which is healthcare access, education access and quality, economic stability, neighborhood and built environment, and then social and community. And I put a graph there to kind of identify what that is, with the patient and the client being in the center, and everything else around them. Social determinants of health have really an impact on health and well-being and quality of life. It could include things like safe housing, transportation, what's the housing like in various neighborhoods. It includes racism and discrimination, violence, education, job opportunities, your income level. If you have access to nutritious foods and physical activities, are you near polluted water, or do you have some language and literacy skills that you may need help with? So the social determinants of health really contribute to the wide health disparities and inequities that we have across the country. So for an example, people don't have access to stores with healthy foods. They're most likely to not have as good of nutrition, or if their healthcare, it raises their healthcare risks of conditions that really lead to long-term health illnesses. And really, the social determinants of health are promoting health choices. It's not going to eliminate the health disparities in any way, but it's just to make better awareness and improve people's environments so that they can live a healthier life. So we're going to talk about what happens at a well-child visit. And if you guys want to chime in, that's really fine. So the visit really is organized in by the 5 priorities. It's a review of systems. It's an observation of parent and child interactions. It's a comprehensive physical exam, screenings that are appropriate to age, and also includes immunizations. And it's really there to identify and prevent any problems from happening. So the clinic team will find health problems early through needed screening to make sure that all vaccinations are current. It's to review healthy eating. There's usually an oral health screening, and screenings needed at each age, and we'll identify some of that as well. And it's also to check on the child's safety and emotional health and well-being. Anything you all want to add to that? The other thing that they do is they track the growth and development. So the care team will measure the height and weight, how your child learns and grows, any milestones that are they should be doing, and the mental and social health well-being of the child. The well-child visits are a great time to bring up concerns, to talk to your healthcare provider about your child's behavior, the ability to get along with others, sleep, eating, growth, learning, thinking, and problem solving, and physical activity, if there are any concerns of that for parents. And really, the well-child visits creates a team approach. We often talk about medical home. The clinic team, if the well-child visits are done at the clinic, build trust in each other. They help when well and help when sick. They work together for the child and the family needs, and they're also there to find resources to help children and families, such as dentists, community resources, and what might be needed on an individual basis. And sometimes when families may be at a well-child visit, if they haven't been widely supported, we've often gotten some referrals from the clinics for the families that are there from some of the pediatricians. This slide just identifies the recommendations for the schedule on when you should bring your child in for a well visit. So it identifies the birth to 15 months, at what dates those are, 18 months to 3-year-olds at 18, 2 and 2.5, the 3 to 6-year-olds at 3, 4, 5, and 6, and to continue the yearly visits until adulthood for our youth that are transitioning. So why are there well child visits at ages 3 to 6? This identifies year 3, what needs to happen, year 4, what the milestones might be, and year 5 and 6. So you can see it identifies what gross and fine motor skills will be needed, social and language development, what they identify there, and if they're not able to do that, observe some parent and child interactions, assess for any risks and safety, and possible other screenings that might be needed. Anything I need to add there, Jody?
No, I don't think so.
Okay, just checking. On this slide, you can see the schedule from 2 to 5 days old up through the age of 6. So you can see when the developmental screenings might need to be done at 9 months, 18 months, and 2.5. Screening for autism spectrum disorder at 18 months and 2 years, some developmental surveillance, and some psychosocial behavior assessment. Also, there's a link there for the periodicity, I can't talk tonight, schedule that is from the AAP, and that's usually most of it. It's also in a lot of the Bright Futures guidebooks too. And if anybody needs any of those Bright Futures guidebooks, I do have some that I could share as well, because we get the updated guidebooks quite frequently. So the medical neighborhood is really moving beyond the status quo outside of the traditional office. It could be that you have partners in public health, which several of you are on the line, someone from the dental clinic. You might have someone that is helping with communication and care coordination, the promotion of health and disease prevention. You may need somebody that is there to support you, like such as Family Voices, to support your needs if you have a child with special health care needs, and then any culturally appropriate intervention that might be needed. So if you need maybe translation or any of those kind of things, this really amounts to, like I said, the medical neighborhood. So how do we all work together, all the dental offices and primary care and the community resources? We'll talk a little bit about that. So at the primary care office, they utilize the Bright Futures as standards and guidelines. Screenings for physical, mental, and oral health are at the appropriate age, and to be aware of where families can receive the needed help if needs arise. And that's where sometimes if the clinic doesn't always know what some of those community resources are, we might get a phone call from the clinic to ask if we know of additional resources for a family. There's also some care coordination, which helps patients navigate through specialty service and closing the loop on referrals by assisting with information that's been received back to the primary care office. We do some of that care coordination as well, and we are always providing a feedback loop. And then it's also support for children and families during all of the ages. So that's one thing you can see at the primary care office. At the public health service level, you might see health track screenings and immunizations, awareness of the primary care office, and to assist to educate families on the importance of having a primary care provider is reviewed. The awareness of oral health and appropriate screenings and referrals as needed, and education to families. Anything you ladies from public health want to add to that? No? Okay. North Dakota, the well child visit is called North Dakota Health Tracks. And it's also, and Jody, I stole this from a slide from you. It's also known as early periodic screening, diagnosis, and treatment. Actually, I think this is right off the webpage. And it may cover physical exams, hearing and vision checks, glasses and hearing aids, vaccines, shots, and some labs, dental care, braces, fluoride, varnish, health education, behavioral health screenings, and I'm sure that those are increasing quite regularly because of the demand on behavioral health for our pediatric population, growth and development checks, nutrition counseling, and any other health services. Health Tracks benefits may be available to Medicaid enrollees at no charge. It might depend upon where you fall in the Medicaid category and how you are accessing Medicaid. One thing I do want to ask Jody is, or any of you that are on, when a new child is enrolled in Health Tracks, does that family get sent a letter? How does that process work?
Yeah, sure. So when a family becomes eligible for North Dakota Medicaid, they not only do they get letters from their eligibility worker letting them know that they're eligible for Medicaid, but they also get separate letters letting them know that they're eligible for the Health Tracks screening program. We do actually send a couple of those out within the first month that they're eligible for Medicaid. So,
Okay. Is there, I'll talk to you about it another time. But that, I mean, I'm glad of that. I'm just wondering if how, like, say, for an example, Family Voices could help those families to make sure that they may follow up with a well child visit. Is there any way to, I mean, it's something to think about. If there's any way that we can help encourage families to do that.
sure.
So I made provided you a slide with where, and I don't know if this is current, I'm assuming so because it's from the website. So that you have the link there at the bottom on where I got this from, and also identified who who are the health track coordinators across the state. And thank you guys for being on. Is that current, Jody? Pretty current?
Yep,
Okay,
it
good.
is current.
Great.
One thing and I was going to add too is some of the services that are not listed on the slide. Health Tracks is the gateway to certain services. So you have to have a Health Track screening, for example, to get braces.
Mhm.
You have to have a Health Track screening to receive ABA services. That's applied behavior analysis. It not only is it good for preventative health, but we also understand that it's important for families to have those screenings to get additional services as well.
For sure. So for oral health, with the dentist, there's the Smiles for Life program, which is a national program for promoting oral health in primary care. There's some education for all to promote oral health. The dental offices really promote the need for that primary care, and often the dental office will offer education and support for families to connect to either primary care and public health resources as they're appropriate. Have you, from a state level, is there ever like a discussion with the dental association or anything on the well child visits and this whole connection?
Yeah, so it's perfect timing for you to bring this up. So we actually are part of an oral health collaborative where we're working with our partners on the federal side to increase the number of fluoride varnish applications that occur during a well child visit or a Health Tracks visit. So we've actually been working not only with the federal government, but we're also working with Sanford and Blue Cross Blue Shield to do a very large messaging campaign here this summer to promote that, because right before school starts is kind of a key time for a lot of well child checks to happen. And then we're also going to, next Friday, we're going to be presenting at the North Dakota Oral Health Coalition. We've actually gathered some data in regards to the well child visits and how many children are receiving a fluoride varnish at those visits. And we're working on kind of beefing up that medical dental collaboration that we've been working on.
Perfect. I think some of our staff will be at that meeting too. Well, in fact, I know they will. So, and then some of the other community resources is really our Division of Special Health Services, whose mission is to promote a system of care of services for individuals with special health care needs and their families. So they often utilize cross-cutting strategies, care coordination, collaboration, data-informed decisions, information, and education. Kim, these next couple slides are about your division. So if there's anything you want to add, some of the programs and services that they provide are coordinated services program. They have the metabolic food, the multiple disciplinary clinics, the cardiac care for children. They also have a financial coverage program, which assists with diagnostic testing and evaluation and treatment. And also they have a program for Russell-Silver syndrome. Their newborn screening is at the Special Health Services. Hang on, I had to let somebody in. Newborn screening is also at Special Health Services, where they do the blood spot screenings, hearing, and critical congenital heart disease. And then Children with Special Health Care Needs System Enhancement Program. Really, I think our partnership probably falls within that. Is the Family Professional Partnership. They do medical home, make sure that there's adequate health insurance, early and continuous screening, all the things that we have to do with our federal grant as well. Transition to adult services and easy access to services and supports. And I've also put that, well, the link is there as well. Kim, did you have anything that you wanted to add about special health services?
Yeah, I guess since this slideshow was created, we have had a couple of changes in our programs. We no longer have the Cardiac Care for Children program. That was a program where families could qualify regardless of their income, and they would have their cardiac visits covered as long as they were seeing a pediatric cardiologist within the state. We have now turned that into an income eligibility program. So essentially they are lumped under our financial coverage program. And then in the past, for those of you who were familiar with our programs under financial coverage, the diagnostic portion never used to have income eligibility associated with that. For consistency's sake and for a lot of ease on our staff and a lot of ease for families with understanding, we have made that to be income eligibility across the board. However, a family can qualify with a cost share if they're considered over that income amount. So just a couple of small changes.
And the income eligibility is at what percent of the federal poverty level?
Yep, we are at 185% of the federal poverty level, which those of you who are familiar with state programs, we're at the same threshold as WIC.
Awesome, thanks. So just for some references for, I should have added the Family Voices National website on here as well, but the American Academy of Pediatrics is there. I think the Bright Futures 4th edition is healthychildren.org, and then Smiles for Life oralhealth.org also is there. So again, I wanted to thank Pat Spears for sharing the work of the collaborative, because it was perfect timing, because we had just been talking about how important I mean, our families are such frequent flyers to the physicians that well child visits is often overlooked. So anything that any of you all can do to encourage families to participate in the well child visits, I know I'll be appreciative of that as well. Sometimes families think that, you know, when they're there a lot. I mean, we used to do the same thing too, and we felt like we were there every other week. So why do we need to go back for a well child visit? But really, it's that head to toe outlook for. And I know that Family Voices National is in the middle of another Bright Futures. Go ahead, Jody.
Well, Deneen, I was just gonna say too, North Dakota Medicaid does allow providers to do a well child visit at a sick visit as well. So so the only thing is like the provider has to have the time to do it.
Right.
So, for your families, if they're going in and they're going to be seen for something in particular, they may want to say, and can we have a well child check that day as well, to alert the individuals that are
Right.
making the appointments to know that I need a little bit more time with the provider so that my child can get the well child check at the same time and not have to be brought in for another doctor appointment.
Right. Great point. Great point. So if you have any questions at all, now would be the time to do it. I mean, you all know what's happening with well child visits, but is there anything that you all want to talk about amongst each other as far as public health and Department of Health and Department of Human Services while we're on the line? Is there anything that would make this feel a little more seamless between everybody, between public health, Department of Health, and you're all going to be under one roof soon? Right?
I can say from the MCH standpoint, which is maternal and child health, one of our priorities, and I know Heather's on the call, so I'm kind of picking on her. One of our priorities for these next 5 years is to improve our rates around adolescent well visits. And so I know she has some really great ideas that she's working on, as far as sports physicals and mental health visits and screenings. So I'm really excited about the new grantees that she's working with and some of the new partnerships that she's forming. Recently, she had a call with the incoming president for the North Dakota chapter of the American Academy of Pediatrics, as Dr. Anderson is getting ready to kind of turn her post over. And it's going to be Dr. Chris Tiang's son, who's going to be the new incoming president, who we're very familiar with. And he's really excited about the things that we're trying to work on with adolescent health. And so he's more than happy to work with us and help us along. And so I just think right now is a really good opportunity. And I think with the Department of Health and Human Services merging, we'll have kind of even more power to move things forward. So all in all, I think it's just good timing.
That's awesome. I didn't know that Dr. Tianson had taken over. So that's good news. I mean, it's not, Dr. Anderson did a great job, but I think I've known Dr. Tianson longer than Dr.
Yeah, I don't know, Heather,
They're
did
both
they say
great.
when exactly they're transitioning, person to person?
I think it was July, if I remember right.
Okay. That's awesome. Jody or any of the health track coordinators, anything that you want to add, or any questions that you have, or on why did Family Voices get involved in health track screenings?
No, we just think it's great. Great collaborative, great information. We ourselves are trying to look at how we can better inform families and how we can have better partnerships with our providers. So, we're just looking at all of these things, and I'm glad we could be a part of the call tonight.
Yeah. Jody, did I see that you are part of a collaborative with the Robert Wood Johnson Foundation?
It's not really the Robert Wood Johnson. It's Center for Healthcare Strategy.
Right.
Yeah, so we're working with them to do some brainstorming in regards to health tracks and moving health tracks forward and some positive changes that could be coming down the road here.
Awesome. Well, if you need a family voice at that table, I'll volunteer.
Okay.
I had just seen that announcement come out. I know that I think there's 2 of the National Family Voices folks that were working on that at a national level on the initiative. So that's how I got that information. Actually, it was today. So anything else that anybody can think of that needs to be added so that when we put this recording up that that you would want to advise families on, maybe I should say it that way, on the importance of getting your well child health track screening. Anything you want to add? I could show the video, but it'll also be up on the website. And then when we get done tonight, after I download this recording, there's also a fact sheet that I'll send to everybody too that we're going to also put up on the website as well to go along with this presentation. Sometimes what has happened in the past is if I send out all the materials beforehand, then they got the materials, but then they don't show up. So we've decided to send it all out after the fact. Oh. Well, thank you all. It's still a nice evening. It's still sometimes some daylight. You could go out for a little cruise or a walk, which is what I'm going to do. I was diagnosed in October with diabetes, so I have walked more and rode a bike more than I think I've ever done in my life just to keep my blood sugar down. So it's been a positive improvement, I think. So thank you all for joining tonight. And if you have any questions or thoughts after the fact, just let me know. And Jody, like I said, if you can help in any way, let me know.
Wonderful. Thank you.
Yeah. Good night, everyone.
Thank you.
Good night.
Good night.
Good night.
Good night, Joan.
Sorry I was late.
Oh, no worries.